Hello, I'm Brian Ulery, Chief Executive Officer of St. Clare's Health, and thank you for joining us for Let's Talk Health. I'm here with Dr. Ali Elfandi, Interventional Cardiologist at St. Clare's. Dr. Elfandi is board certified in internal medicine, cardiovascular medicine, echocardiography, and nuclear medicine. Today we are here to discuss women and their heart health. Welcome, Dr. Elfandi.
Thank you.
We know that women are very special and unique in many ways, and particularly in terms of their cardiovascular health. What are the unique differences between men and women that affect heart health?
Yes, that's a very good question. So when you look at the differences between men and women, early on in life, women in particular, they are exposed to the stresses of pregnancy, which can lead to different heart conditions that are more specific to women compared to men. And then later in life, women tend to develop coronary artery disease, for example, later than men due to the protective property of their hormones. So in general, women are at their highest risk of coronary artery disease later in life after the age of 65. On the other hand, usually men develop coronary artery disease earlier than that. Again, it's due to the hormonal differences that we see between men and women.
Great. Well, as a comparison, we know there is an emphasis on women and their breast cancer risks. However, my understanding is heart disease kills more women than breast cancer and is the leading cause of death for women. Can you share data to illustrate that comparison?
Yes, that is correct. So it's known that in the U.S., breast cancer kills about 1 in 30 women. On the other hand, heart disease is estimated to be the cause of death in 1 in about 10 women. So heart disease definitely is the #1 killer for women, and the same goes for men as well.
Okay. And with heart risks being such a big deal for women, at what age do we see heart disease begin to appear in most women?
Very good question. So again, we go back to the differences between men and women. Women can be exposed to heart disease as early as age of 20.
Wow.
And coronary atherosclerosis, which is the plaque buildup in the arteries, it usually develops. It takes decades in development and eventually to manifest itself as heart attacks. So as early as the age of 20, people can develop heart disease.
Wow. What are the risk factors for cardiovascular disease, and what can we do to prevent heart disease?
So there's several risk factors. So if we start basic risk factors, we talk about people who lead a sedentary lifestyle. So people who are inactive, that's a very important cause. And then we can talk about the traditional risk factors, such as people who have diabetes, people who have high blood pressure, people who have cholesterol issues, people who have strong family history of coronary artery disease, and it's usually because of their genetic predisposition. And then also bad habits such as smoking is also very important risk factors for developing coronary artery disease.
Many people believe that cardiovascular diseases, or CVD, is limited to heart attacks. Can you please explain to our audience the various types of cardiovascular disease?
Absolutely. So when we talk about heart disease, there's a big spectrum of different cardiac illnesses or cardiac diseases. So coronary artery disease is one of them, which basically describes the development of plaque or cholesterol inside the blood vessels that feed the heart. Other entities include structural problems with the heart. So when you have people who develop heart failure basically is weakness of the heart muscles. The other things that we also can describe when we come to structural heart disease is valvular heart disease. So issues with any of the 4 major valves of the heart, which may include narrowing of the valve or leakiness of the valves. And then we also have electrical issues of the heart. We have what we call in medical terms arrhythmias, or people sometimes describe them as irregular heartbeats. So, and then we also have other conditions such as congenital heart disease. So people who are born with defects or problems in their heart. So these are the general problems or heart conditions that people may be exposed to and develop.
Okay. If a woman is having symptoms or is concerned, what are the medical tests to diagnose heart health?
Very good. So when it comes to, there's several things that we do to evaluate patients for coronary artery disease or for heart disease in general. So we usually start with a detailed history whenever we're interviewing a patient, and what we try to get out of this history is their risk for developing heart disease. And that goes with determining their risk factors that we just described, and then also look into their family history. And after that, look at their daily habits. And as a result, we describe a certain workup. So that may include doing an EKG, which is an electrocardiogram that assesses the electricity of the heart. And based on that, we can tell if the patient had a prior heart attack or has current issues. Another common test that we usually order is an echocardiogram. So that basically looks at the structure of the heart. We can assess the heart function, look at the valves. And then another important test that we usually order is stress tests. And we have different modalities and different tests under stress tests that we can order that can also help us look into the possibility of having coronary heart disease. And besides those tests, we also can order certain blood tests that can also help us and guide us into managing our patients.
Okay. What are the symptoms of a heart attack, and how does it differ between men and women?
Very good question. So classic symptoms of heart attack in general, usually if patient develops a heart attack, they have chest pain. They usually describe substernal chest pressure, and usually it travels sometimes to the arm, to the neck, or to the jaw. Other symptoms may include having the sensation of heartburn, and that sometimes can be subtle, and patients can brush it off thinking it's a stomach problem. Other symptoms with heart attacks includes sweatiness or diaphoresis. People feel also nauseous, dizziness, and also sometimes even passing out. So those are usually the common symptoms. In women in particular, at times they could present with what we call atypical symptoms, so symptoms that are not really straightforward. And those kind of symptoms at times may delay diagnosis and delay seeking medical attention. And that may include having some heartburn. And I always tell patients that the symptoms of heart attacks can be very subtle. So you don't have to have severe chest pain for you to think that it's actually a heart attack. So at times it can be very subtle, and it can present itself as, like I said, stomach problems or heartburn or nausea. Or another very important thing, especially for women, they can present with shortness of breath. That can be the only symptom. So it can be sudden onset of shortness of breath. So those are the main symptoms that we usually see.
Well, with all that variation with symptoms, are all heart attacks the same?
They're not. So if I would describe heart attacks in lay terms, so we have a heart attack what we call a major heart attack, or we call it in medical terms STEMI. So basically what that describes is a complete occlusion of one of the blood vessels of the heart. And that's a medical emergency. So patients have to be taken care of right away. Otherwise, significant muscle damage can happen. The other type of heart attacks is where the patient does have an event where patients develop a plaque rupture in their heart, but the blood vessel does not completely occlude. There's still flow. So in that situation, we usually have time. It's still an urgent situation, but it's different from what we call a major heart attack.
So what are the treatments for heart attacks?
Yes, so very good question. So when a major heart attack develops, so the treatment for that is to reestablish blood flow to the heart. And the way that we do that these days is we take patients to the cardiac catheterization lab emergently, and we put in a balloon and we open the artery, and after that we deploy a stent to keep the artery open, and that's the way we establish blood flow. On top of the procedure itself, obviously we start the patients on blood thinners, and there's different blood thinners that we also start them on prior to the procedure to make sure no clots develop inside the artery, and also to dissolve any clots that are there at the time of the procedure.
When is it time to seek care?
Absolutely. So anytime you develop symptoms that you know for a fact that it's new to you. So for example, if you're used to walking a mile or two every day around your house or a park, and then you notice suddenly that you're not able to do that, whether you're developing some shortness of breath, some chest tightness with exertion, or in other instances, patients sometimes may have, like I said, non-classic symptoms such as recurrent heartburn that's not responding to medications. So in those instances, you ought to seek medical attention and be checked up, make sure that you're not developing coronary artery disease or coronary blockages. Another instance would be just, for preventive checkup, where patients, especially who have traditional risk factors or have strong family history of heart disease, I would suggest that you be proactive and get checked as early as you can to be on top of your health and prevent the possibility of developing a heart attack.
Right. Well, we say that St. Clare's Health is around the corner and ahead of the curve. What does that mean in terms of the type of care that you can receive at St. Clare's?
Excellent question. So If we're going to talk about our heart attack management in particular for our patients here in the community, it's very important to seek medical attention to your nearest facility if you ever develop a heart attack. So when patients develop heart attack, you want to be as close as possible to the hospital. So as a community hospital here, we are able to provide cardiovascular care at its highest standard, compared to any other hospital in the area. We have the latest equipment in our cardiac catheterization lab that would allow us to provide for advanced cardiovascular care and taking care of heart attack patients in particular.
Mm-hmm. And with the exception of open heart, we have everything. Is that what you're saying?
Pretty much, yes.
That's what I believe as well.
Yes.
And, with a physician as good as you and as qualified as you, I'm sure that there are people who are going to want to reach out and find your services for care. How can they do that?
Yes, absolutely. So our office here is in Denville, 16 Pocono Road, Suite 100, and our phone number is 973-784-6900.
Well, thank you, Dr. Elfandi, for sharing this important information with us. For more questions about your cardiac health or to make an appointment with Dr. Elfandi, please call 973-784-6900. We thank you for watching Let's Talk Health and invite you to follow us on Facebook, Instagram, or YouTube. For more information, visit stclares.com. Thank you.